We are comparing Gliclazide, Glimepiride, and Glibenclamide medications for controlling blood sugar. They all belong to one group called sulfonylureas. Original approval dates were Glibenclamide in 1984, Glimepiride in 1995, and Gliclazide in 1972. But it is not available in the US. Gliclazide is considered a second-generation sulfonylurea, but unlike the others, it is not approved for use in the United States. All three medications are available in extended or modified release (XR/MR) versions, with Gliclazide and Glimepiride being commonly available as modified release (MR) or extended release (XR) formulations for once-daily dosing. Glibenclamide, also known as Glimepiride, is available in different formulations, though an explicit XR/MR version is not as prominently described as for the others. If you can afford it, you should select SGLT2 type medication and Metformin as first and second choice. Sulfonylureas may be the third choice. In one research, Gliclazide lowered HbA1c by 2.44%, while Glimepiride lowered it by 1.91%. Another research found Glimepiride and Gliclazide worked equally well when combined with Metformin, giving similar reductions in blood sugar. Glibenclamide also lowers blood sugar well. It worked almost as well as insulin in some research, with good control in 84 to 90% of people. But Glibenclamide carries more safety risks than the other two medicines. The differences in blood sugar control between these medicines are small. Most people can get good results with any of them when used as directed. The biggest concern with sulfonylureas is hypoglycaemia, or low blood sugar. This can cause shaking, sweating, confusion, and even be life-threatening. Research shows differences in the risk of low blood sugar. Gliclazide gives the lowest risk. Only 3.7% of people taking Gliclazide had a confirmed low blood sugar, compared to 8.9% for Glimepiride. Glibenclamide has the highest risk for causing hypoglycemia. About 20 to 30% of people who take it experience low blood sugar, compared to only 2 to 4% with Glimepiride. One research found severe hypoglycemia happened 5.6 times per 1,000 people per year with Glibenclamide. Glimepiride caused severe low blood sugar only 0.86 times per 1,000 people per year. These differences happen because of how long these medicines stay active and how they interact with blood sugar control systems. Glibenclamide affects the body's natural safety net for stopping insulin when blood sugar drops. Gliclazide and Glimepiride are less likely to block this safety net. Weight gain can happen with sulfonylurea drugs. All three can cause weight gain, but Glibenclamide tends to add the most. The average weight gain is about 2 to 3 kilograms, but it can vary from person to person. Digestive problems like nausea, heartburn, and stomach upset are possible with all three medicines. These side effects are usually mild and improve as your body gets used to the medicine. Some people may get skin reactions, like rashes or extra sensitivity to sunlight. These are rare but can happen with any of the three drugs. Overdose is a real concern. Too much sulfonylurea medicine can lead to dangerous low blood sugar for days. Glibenclamide brings the highest risk, partly because it stays in the body longer and has stronger effects. Sometimes overdose can cause problems that last up to 8 days. Glimepiride and Gliclazide are safer if taken in too high a dose, but they still need quick medical care. Modified release versions can be tricky because they release medicine slowly over many hours. Age matters a lot when picking a medicine. Glibenclamide is not recommended for people over 65 years old. The risk of long and severe low blood sugar is too high. Doctors often prefer Gliclazide or Glimepiride for older people, especially those with mild kidney problems. People with kidney issues face higher risks with all sulfonylureas. Glibenclamide should not be used if kidney function is less than half of normal. Glimepiride and Gliclazide can be used with some caution for mild or moderate kidney problems, but the dose must be reduced and safety checks are more important. Safe blood vessel and heart health is very important for people with diabetes. Some research found that using Gliclazide to aim for tighter blood sugar control, along with other drugs, reduced major heart problems by 10%. Other research showed Glimepiride is as safe for the heart as newer diabetes drugs. Glibenclamide has shown worrying effects on the heart and blood vessels. It may not give the same heart protection as the other medicines and could even raise some risks. Sulfonylurea medicines remain quite popular in India. Prescription surveys from hospitals show sulfonylureas are used for about 27 to 68% of diabetes patients. Glimepiride is especially popular these days, often used with Metformin. The combination of Glimepiride and Metformin is one of the most used diabetes treatments in India. Cost is a big reason these medicines are popular. Sulfonylureas cost much less than newer diabetes drugs, making them an attractive choice for many people. But safety should not be ignored just to save money. Understanding how to take these medicines is important. Glimepiride is usually started at 1 to 2 milligrams once a day and can be increased to 8 milligrams per day. Most people take it at breakfast time. Gliclazide regular tablets are taken twice per day. Typical doses are 40 to 160 milligrams per day. The modified release type can be taken once per day at a dose of 30 to 120 milligrams. This makes it easier for people who want fewer pills every day. Glibenclamide is started at 2.5 to 5 milligrams once or twice per day, with a maximum of 20 milligrams per day. Doctors now recommend starting at low doses and increasing slowly. These medicines can interact with other drugs. Some common drugs can raise the risk of low blood sugar, such as certain antibiotics, blood thinners, and some painkillers. Drinking alcohol also increases the risk of low blood sugar with all three medicines. Regular monitoring is needed for these medicines. Blood sugar should be checked often, and HbA1c every 3 to 6 months. Kidney and liver function checks are important, especially in older people or those with health problems. Choosing the right medicine depends on many factors. For most people, Gliclazide gives the best mix of safety and effectiveness, with the lowest risk of low blood sugar. Glimepiride is also a safe choice, especially for those who want once-daily tablets or have mild kidney problems. Glibenclamide is effective but carries higher risks, so it is not the first choice, especially for older or kidney patients. The decision should always be made with a doctor, who will look at age, kidney health, other medicines taken, and lifestyle. Regular checkups are important no matter which medicine is chosen. Sulfonylurea medicines can be safe and effective when the right drug is chosen and used properly. Gliclazide or Glimepiride will usually offer better safety than Glibenclamide, especially for older adults and those with health problems. The minor difference in cost is worth the extra safety given by the newer drugs. With the right advice and careful use, these medicines can help manage diabetes well. Consult your healthcare professional before changing your medication or lifestyle. Please click the like button and subscribe if you think this video is useful. On the screen, you see an essential video about another cheap medication used for diabetes for you. Thanks very much for watching this video. References are in the comments and description sections. See you in the next video.